Okay. Hello class, my name is Nicholas Solares and I have my younger brother here, Michael Solares. We're going to be administering 3 tests today. We're going to be showing how to properly take blood pressure using a manual sigmometer. We're going to do the skin fold test, and then we're going to be taking his hip to waist measurements. So first we're going to start off with doing the blood pressure tests. So you're going to want to slide the compression sleeve over at least an inch past the elbow. Then you're going to want to make sure you lock in so the air doesn't escape. So when we're using a manual blood pressure monitor, what we're going to do is we're going to rapidly inflate it to 180 psi. Oh well, in this case it'd be mercury. And once it reaches 180 mercury, we're going to allow it to decompress at a rate of 3 millimeters per second. And when it starts to go down, you're going to want to keep an eye on the meter and have the stethoscope on the vein to be able to calculate, well, to be able to hear when you would hear the systolic blood pressure. So you're going to usually hear between the 120 and 140 range, and it's going to sound like a knocking sound. When you stop hearing that knocking sound, that's when you get your diastolic pressure. So we're going to go ahead and start administering this. Okay, so we recorded a blood pressure of about 125 over 82. We're going to go ahead and mark that down. And we'll go ahead and slide this out. Okay, so for our next test, we're going to be taking measurements from his hip and his waist, and then dividing it to get our accurate hip to waist measurement. If you want to go ahead and stand up. So you're going to want to get the biggest part of the waist and the biggest part of the hips, which would be around the butt area, and then the waist around above the pelvis. So go ahead and pull that up. So we're getting a hip measurement at about 38 inches. So let's go ahead and mark that down. And now we're going to go ahead and measure the waist. And our waist measurement comes out to 32.5 inches. So what you're going to want to do is divide the waist circumference by the hip circumference, and that value is going to determine whether he is in a low risk area for heart disease. So take our calculator real quick. .5 divided by 38. He's in 0.85, so he is well under the risk for heart disease. So then our final test is going to be our skin fold test. For the skin fold test, we're going to be following Jackson Pollock's 3-site skin fold equation. And the first one we're going to be administering is the one to the abdomen. I will then be doing all 4 measurements, but I will not be reporting them. So you're going to want to get part of the abdomen which has the most skin, or in this case fat, whatever you would want to call it. You're going to want to grab it, make sure you fully compress it, and monitor what reading you're at. So my reading is showing me 13 millimeters. So if we look at our handy chart we have here, we can take into account the millimeters and determine whether he's at a lean, ideal, average, or above average body fat. So we measured at 13 millimeters. He is 18 years old. So he'd be right in the 12.5% body fat, which is ideal. So he is in what looks to be great health, and all the tests came out perfect, and I'll just be administering the